My name is Natalie Callander, and I'm from the University of Wisconsin. And what I'd like to talk to today is the update on what's called the Aquila or the Aquila trial, depending on how you like to pronounce that. So this was the largest randomized phase 3 trial for high-risk smoldering myeloma that's been presented to date. It's about 400 patients. Now, one of the things about the study that are important to know, it is still divided into half getting the drug daratumumab for about 3 years and half being on observation. And to be on this trial, you had to meet a special definition of high-risk smoldering myeloma. And so this included some things that maybe not necessarily we use in the U.S. So these are things just like an IgA monoclonal protein got you in, 3 grams per deciliter of a monoclonal protein. That's a more standard one, 50 to 60% plasma cells in a bone marrow, some immunopoiesis, and there was some discussion when this was presented at last year's ASH, okay, is that really a high-risk group, not meeting perhaps a very common definition we use in the U.S. called the 22-20 model. And that means you're talking about individuals who have more than 20% plasma cells in their bone marrow, a free light chain ratio above 20 for the involved over uninvolved, or a monoclonal protein above 2 grams per deciliter. And high risk in that classification is considered 2 of those 3. And what Dr. Voorhees did yesterday is updated the Aquila study based on using the 22-20 criteria. And I think what was very much validating both for that scoring system, but for their data is the patients who benefited the most were those high-risk smoldering, people who had 2 or more of the 22-20, and people who had none, 0, actually didn't have any benefit at all. And I think that that's something to keep in mind as we assume, well, now with the new FDA approval for daratumumab, we assume more patients may be asked to consider this, but it really looks like this would be something that you want to ask your provider, do I meet that definition? Can you help me understand, am I in that group that's high risk? Because it really looks like that's where all the benefit is going to be.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.